Additionally, other countries too have birth and death registries. Some of these things are also recorded. The environmental officer may be on the known, and these things will be at least duly recorded there. So when we make follow-ups on these things, you'll be able to make additional contact tracing that this person died as a result of this, where people associated with him or her. So through contact tracing, we'll be able to link up and find out that through this source of exposure, A, B, and C died, and then that kind of thing. I think to some extent it will also help. Thanks and over.
All right, thanks. But you answered the wrong question though. We're saying, how do you establish you drank water? You are answering the question of how do we assess the source of the outcome, but we're trying to measure.
Sorry, Prof, I didn't get a question right. Sorry, yeah. I didn't get the question.
Okay, so the context is right. We've agreed that we're going to design a retrospective cohort. Your approach is you are assuming your approach is as though we're designing a case control study. We've said that we're designing a retrospective cohort, and so we have to establish exposures. Right. And so we've said that for ease of just, classification, we're going to divide these people into children, adults, and businesses. So again, my question is for children, how are you going to establish exposure?
I think we might need to look at the medical register or medical history. Probably they had undertaken a laboratory test.
Okay. Let me stop you there, right? So, but when you say medical records, that assumes that they went where?
They went to the hospital.
Is it everybody, especially when you look at Flint, which is a very poor community? Are you going to capture the exposure? Remember that we agreed collectively that we're going to do a retrospective cohort because we all agreed that it was going to be easy for us to capture the exposure. Taiwo, you have your hand up. Do you want to help us out here?
Yes, for children, we may need to find out their place of birth and the time of birth. Their place of birth and the time of birth may help us to know whether they are exposed.
Okay, thank you. Any other thoughts? Johnson, Victor?
Okay, so I was just thinking if it's possible to get the chronological age and comparing it to the time at which the exposure occurred, and from there you're able to know, okay, certain age group fall under this period, and they might likely be exposed to that, and the location also.
All right, thanks. Well, you guys are
Prof, hello, Prof.
Yes, please go ahead.
I'm looking at, since it's difficult for us to establish those who are exposed properly, I think case control should be applied, knowing properly that those who are living in that place definitely will be able to establish, will be able to get people who will have the cases. So by the time we sample them, we'll be able to establish the cases. And of course, those who will be used as control are those who were never living in that community. So I'm looking at case control should be applied.
Okay, okay, let's stick with that. There are flaws in your argument, but we'll come back to that later.
Okay, Prof.
All right, great. Now, let's establish the issue of exposure, right? You guys are leaving the most obvious sources of records and telling me very complicated stuff. How do you establish that a child was exposed to water, in this case, at a particular time? What are some secondary records you might use? Christopher, your hand is up.
Yes, Prof, I think those who came down with the disease from their medical record, from the history, clinical history, we're able to know their source of water. That may give a clue to exposure in this case.
Okay, but you are, by saying you are going to look at people who had their medical records, that's a different study design altogether, right? You are looking at a case series now. You are saying we're going to look at people who had Legionnaire's disease, and we're going to look at the exposure. That's not like a cohort study. It's a case series. The case series, remember, is a study where you have people who have all developed the outcome. So you are completely changing the study design midway. Yes, Michael.
Can I? Okay. Yeah, the the children, they have parents who care for them, and then we can find out from the parents the history of how the children drink this water, and that will also help us to have an idea whether they were really exposed or not.
Okay, thanks. Now, remember that we have $650 million here to disburse. Do you think parents are going to say, yeah, we're exposed? Yes or no? What do you think?
They will say,
Of course,
yeah,
everybody
but
exposed. Oh, I was very exposed. My child drank all the water. So you see why we cannot go with that. Okay. Let's just think of this way. Where do kids go every single day? Well, most days.
School.
They go to schools.
School.
Kids go to school, right?
Yes.
Now, we need to check, and in communities, maybe this is not very generalizable elsewhere, but the tap water is the most common source of of water, right, for folks. So we're going to check, was this child enrolled in school, within this area, within Flint, during the time of interest, right? Again, remember that it's for a child who is dead, we cannot pinpoint that this child drank this water at this time. But you want to use some reasonable evidence, objective evidence, to say that yes, this child, at least we know that they stayed in this area, and so they are very likely. So in cases like this, the metric we use is that it is more likely than not that they will have been exposed, because it's impossible for us to pinpoint with great accuracy exposure for anybody. So the metric here is, from a legal perspective, is it more likely than not? So in other words, I'm just looking for the probability that is above 51% that yes, they were exposed, right? So in this case, for kids, for example, I'll use their school records where you enrolled in a school, right? Or I can also look at, tax records, right? That individuals were living here, because if you live in the house, you likely paid rent. So if you have rental records, if you had, mortgage, if you had other records that I can obtain, right? But it has to be records that I can obtain for everybody in the population. That's why we cannot say we're just going to use hospital records, because that's a different study design entirely, right? It has to be something that we can collect for everybody. Michael, your hand, is that an old hand or a new hand?
No, it's a new one. Prof, what happens to those children that are not up to school age and have not gone to school, and they are also part of this? How do we get information on them?
And that's where we use their parent. That's what we talk about, like mortgage records of their parents. They live with their parents, right? So we can establish that they lived in this period in time. We can also check medical records, but not as a primary source of record. Like, did they school here? Did they live here? Did they work here? Right? In other words, all we're trying to establish is that, is there reasonable evidence to conclude that these people were exposed to this water at this point? So your first task as an epidemiologist, in this kind of case, is to establish, define what exposure is, right? So in this case, this was how, we define exposure. You owned or lived in a residence that received water from the Flint water treatment plant. You owned or operated a business that received water from the plant. There's evidence that you came into contact with water from the Flint for at least 21 days during any 30-day period, right? So those are some of the criteria, we use. So your first job as an epidemiologist, these are some of the more nuanced things, right? How do we measure? How do we classify people who are exposed or non-exposed, right? So that is the exposure. Now, we all agree that we are going to design a retrospective cohort because it's easier for us to measure water consumption. Now, this may seem complicated, but well, try till you're trying to measure Legionnaire's disease, then you realize that, oh, let's just go with the water. Water is easier. So again, that's why I said earlier that you start with, what do I have in my hand, which is easier for me to measure. I'm sorry, you have your hand up, Fonka. Do you have a question?
Yes, Prof.
Yes, go ahead.
When you talk about going to school, in my mind, it's like we are still trying to establish the population that is involved. Because I feel that when these children are in school, if there is an epidemic, it is the hospitals around that get the records and not the school. But I feel that in school, we can actually find out whether these children were actually living, were actually registered in the school, meaning that can they fall within the population or they just came in? Because we can be talking at the situation when some parents are just getting into the place and they are also claiming that their children were involved. But the school now will tell us that these children were actually in school. But to have the medical records, whether they were actually affected, I think I wonder if the school actually keeps such records. Is it not the hospitals around?
We're not interested in the hospital records. This is a cohort study. This is not a case series. For whatever reason, you guys always seem to default to a case series. We'll go to the hospital and collect records for everybody who has the outcome. We're not interested in the outcome yet. We're interested in a retrospective cohort starts with exposure. So we're going back in time. Remember, we said in the retrospective cohort, it's like we are going back in time to the beginning and saying, okay, who lived here, who was exposed at this point, right? The population has already been defined. We've already defined the population as by saying, individuals who live in Flint. That's already defined, right? We can use an adjacent city as a control, but this is already well defined. We don't need to define it twice. So we're saying within this group, how do we capture exposure, right? And the exposure we have to measure exposure for everybody, whether they're adults, whether they're children, whether they're businesses, as far as they lived in that area. Because remember, we have $650 million at stake here, right? And we need to make sure that we establish that the exposure was associated with the outcome, number one. And the two, the people who are paying this money to truly were exposed. So it can't be just going to the hospital, because there are a lot of people who do not go to the hospital. And that's not the issue we're even trying to establish. We're trying to establish exposure. Why? Because we have agreed that we're going to do a retrospective cohort. I hope that makes sense to you. All right, let's move on.
It does, Prof. It does.
Okay. All right. So now we've captured everybody who was exposed and unexposed, right? Now for the outcome, which was Legionnaires' disease, how do we capture it? Yes, Emmanuel.
Prof, I think it's more like a question I want to ask. Is it only one outcome that those individuals had?
In this study, yes. In this case, this is the outcome of interest. And again, from a legal perspective, you look at what you want to make sure your legal argument is as clean. You don't want to just start spreading so many arguments in the air. You want a concise, clear argument. So Legionnaires' disease was the strongest outcome that could relate with that. So you don't want to make a puddle of your argument. So in this case, we were interested in one. Now, it's a different thing if you are doing the study, right, and you're just interested in knowing a whole lot of other things. In this case, this was the outcome of interest. Taiwo, your hand is up.
Yeah, to know those who have the outcome, I think we look at records of those who have confirmed cases of Legionnaires' disease.
Okay, so let us group these people, right, into three groups: those who have died, those who are alive and went to a hospital, during that period, and those who are alive and did not go. Those who are dead, how do we assess it?
You might do autopsy.
We should know the cause of death. We should know the cause of death of those who are dead.
Okay. Someone said autopsy. Why might that not be realistic?
Put that long buried.
Someone has been long buried 5 years ago. Right. I can imagine it's kind of hard to do autopsy on this guy, right?
Hospital record will tell us the cause of death.
Okay.
For some of this.
So death
construct case definition and use that to make sure that we capture everybody that fits into the criteria.
Exactly. What do death certificates have on them?
Death certificates will tell us the
cause of
disease
death
that brought the hospital, that brought the patient to the hospital, the primary and the secondary causes of death.
Exactly. So we're going to know causes for those who have died. We're going to look at death certificates. This person died from this condition. We know that. What of those who are alive? How could we establish whether they have this outcome of interest?
Go through their medical records.
And if they don't have records?
If they don't have records, we can get information from their homes.
What if they're right in front of us? Like, can we examine that? Can we run tests?
Can run tests.
So this brings me to a very important part, right? So the fact that it's retrospective doesn't mean that everything is historical. Sometimes even in retrospective studies, we might need to collect data, right? We might need to do examinations. So that's the one part I really want us to understand, right? The outcome has already occurred in the past, but we are just trying to capture it at that moment, right? So you want to think of it very holistically, right? Now, in the case of, especially for legal cases like this, you would have to prepare, as the chief epidemiologist, you would have to prepare an affidavit like this for every single individual. Why do you think that is? Why do you think that is important?
To have a legal backup.
Legal backup, yes. What else?
To authenticate your facts.
That individual person is eligible to claim anything from anybody.
Exactly. And again, remember, so this, you can understand why this is a serious issue, right? Because remember, for each individual, you have to do an extensive amount of work to establish this exposure outcome, right? So it's not just collecting data casually, it's a lot of work. Now, and again, because the stakes are high, you have $650 million to disburse. So of course, you want to make sure that, it's because your neck is on the line, right? If it's not done correctly. Now, let's look at it from the business model. Why does it make sense also? Because at the end of the day, epidemiologists should also be entrepreneurial in their mindset. Why is it also a benefit for you to have affidavits one for individual? What's the business model here for you as an epidemiologist? Are you pricing your services for the whole project, or are you pricing per affidavit? What do you think makes sense? I don't know business.
To price per affidavit.
Yeah, you price
for business model, it's better to price per affidavit.
Exactly, and that's how it's done. So it's charged per affidavit. Of course, if you're going to disburse 650 million, well, I should have my own thought too, right? If I'm the one doing all the work to establish all of this, but primarily it's to make sure that we actually measure the exposures and outcomes precisely. We measure the associations precisely, but also secondarily and less important, that you also get paid for your time and effort. All right, so that is how that's how we capture those studies, and that's how you want to think through those things in the field. Now, coming back to the individual who said, "Oh, let's actually just abandon this and let's look at a case control study." That will not necessarily work because, again, we'll have to go and figure out all the cases of Legionnaire's disease first. Remember that the first thing we started from was, what do we have in our hands that is easier? Any day, anytime, I will pick measuring exposure to water than trying to determine who has Legionnaire's disease. Like it's one is obviously very easy, So you don't just want to bring because again, remember that once you are in charge of a huge, massive project like this, there are just so many things that you are going to answer for. This is not a time to be doing trial and error. So you have to be Now, we're not saying that the case control study will not be able to answer the question. We're saying that which is the most efficient study design that would give rise to a very robust answer, right? So those are some of the realistic decisions you would have to make in the field. Again, many study designs can answer a question, but you have to make sure you pick the one that is, the most robust and the most, well suited for the research question on hand. Now, if there are any questions, I'll answer them. Otherwise, let's go to see how we can some of the elements in the proposal because of course, if you are in academic context, you might have to write a proposal for a case control or a cohort, retrospective or prospective. We want to see some of the elements in those different proposals that differ across the different study designs. But I want to see if you have any questions first before we do that. I'll take one or two questions and then we'll go and look at some of the differences in the proposals, and then we'll take the rest of the questions. Any questions?
Yes, Prof. So for those that are still alive, how might we be able to know if they are exposed? Because I'm not sure whether the Legionnaire would still be in the blood after so many years.
You are mixing terminology. Are you referring to exposed or are you talking about the outcome?
I mean the outcome, sorry.
Okay. So you would so when you are doing things of this nature, I will please meet ourselves. So you have to come up with case definitions, right? You would have to come up with case definitions to capture. You want to make sure that you have experts on that panel. So you have an infectious, in this case, you want to make sure you have an infectious disease doctor that will come up with definitions, right? For things that we can measure radiologically, right? Some things the individuals may have recovered, but in some cases there might be some radiologic evidence of past exposure or past disease. In some instances, we might measure serum levels. They might have recovered, but there might still be serologic evidence that they had that exposure. It depends on a case-by-case basis, right? If they were treated, for example, we will also examine records. So typically, when you are constructing a case definition, it's never just one thing, right? It could be based on a myriad of factors like symptomatology, like hospital records, like objective records, and also reports, self-reports. Sometimes you can say, okay, have you ever been told by a doctor? In evident cases where we don't have any other thing, we can also ask by self-report. Has a doctor ever told you in the past whatever that you have so and so? It depends on the context, it's just that in legal cases like this, we want to make sure that we're a bit more precise in how we measure things. But we can never, when you're working in the field, you just have to know that you will never, ever have 100% of information. It's always going to be muddy and, but you just have to do the best you can and make sure that what you have presented is the best available version of the truth. I hope that answers your question.
Hello, Professor.
Yes, sir.
Hello,
Yes.
Professor.
Yes.
So if I get to the approach to the compensation, are we compensating those who were exposed, who have confirmed were exposed to these who have confirmed are exposed, or those who have confirmed have the disease? Because what about those who were exposed but did not develop the disease? Do they deserve compensation too?
So this is the slide this was the compensation structure. All owners and renters of residential property who receive Flint water during this time will be eligible to recover compensation. Well, because the lead doesn't just damage health, it also damages property. So that was considered, right? All individuals who were minors in Flint, kids, will be eligible to receive compensation without proof of personal injury, with larger amounts of compensation to those who can demonstrate injury, right? Who can demonstrate that this occurred. Then for adults, you are only eligible if there's proof of injury. So that was the structure of the compensation. So the role of epidemiologists here is to make sure that you're making sure everything is well defined. First of all, establishing that there is a relationship between this exposure and this outcome, and for each individual, who is passing through, you will have to sign an affidavit that yes, this is true for this individual. All right. Any last question?
Okay. Okay, Prof. Thank you so much.
Mm-hmm.
Yes, I have a question. Prof.
Yes.
Hello.
Yeah, I can hear you clearly.
Okay. Yes. The work of the epidemiologist here is very fragile. Under a situation where you are not 100% sure of what you are doing, you are just trying to get as much evidence as possible. Do you think that some of these results from the epidemiologist will pass through legal scrutiny?
Yeah. This is why if you have to be extremely sure of what you're doing, right? The absence of 100% evidence doesn't mean that you are so most of this thing boil down to judgment calls, right? And for issues like this, like exposure, well, there's nothing anybody can actually establish definitively. The epidemiologist will argue is the best professional to establish those relationships. And so the bottom line is, this is why you must know you must know what you're doing in and out extremely well, right? This is not a point for you to, this is not a session where you start waving hands or just start saying, well, no, there's no well here. You better know what you're doing, right? And know it extremely well, because you should know that whatever you're saying should be able to withstand cross-examination and intense scrutiny from other experts, right? So yes, so the bottom line of what I'm saying is that yes, epidemiologists are well qualified to do this. This is fragile, but this is why you have to be an expert. And if you are even the slightest bit unsure of the expertise, this is one area you should stay away from. If you have any iota of doubt about your expertise in science of measurement, then you should just stay away from it, because then you'll be torn into shreds. I hope that answers your question.
Hello, Prof. I want to ask a question.
Yes, Prof.
Yes, go ahead.
Hello, Prof.
Yes, go ahead.
I said that is it a single exposure and a single outcome that can actually be used to determine retrospective studies? What if you have many outcomes with a single exposure? What do you use? Please, I want to get that clear. You were saying it, but I didn't get it properly.
Many outcomes, one exposure, that is a retrospective cohort. Many exposures, one outcome, that's best suited for case control. Remember, we talked about food poisoning last week. Food poisoning, where you have a case of diarrhea, one case, one outcome, but you have many things you're suspecting. You're suspecting the Maggi, you're suspecting the onions, you're suspecting everything, right? There are many potential exposures. That is when we best use a case control study for those. So think many exposures, one outcome, think of case control. Many outcomes, one exposure, think of cohort. All right, let's look at a quick demo of how to structure. I really wanted to quickly look at some of the nuances, in case you're writing a proposal, that are different between the three study designs we mentioned. All right, so let's see how we can quickly create the same proposal for three study designs and look at how they are framed differently, so that we can know. So when you're writing a proposal for either a case control retrospective cohort or prospective cohort, you know what to do. So here, let's look at let's say a relationship between consumption, So that is let's just copy the same idea and just keep it short. So first of all, let's look at a case control. Our main exposure is drinking of lead contaminated water. Our main outcome is development of Legionella disease. let's countries, United States. And again, the whole idea behind the concept proposal, the AI toolkit is it's to give you something to start from. Because if you've never designed a particular study, it becomes very hard for you to just start from scratch. So this gives you something to build on, and then you can further develop it. So let me put my name here. Role principal investigator. Let me just say 5-year experience in whatever. It doesn't have whatever you're typing here doesn't have to be complicated. It's just give the AI, give the platform something to work with. So I've put that there, and let's create a proposal. And we're going to, the idea is to compare the proposal from a case control, just look at certain elements of it distinctively that will be different from that of a retrospective cohort as well as that of a prospective cohort. So let me, while we're waiting, let me do the same thing. Let's actually just go back here. While it's generating this, let me create a new one. Or just so we don't confuse you, let me just wait for it. I'll do the one at a time. While we wait for it to develop, does anyone have any other question?
Yeah, Prof, I think I asked the question earlier, but it hasn't been answered.
Okay, sorry, can
It's,
you remind me?
okay. Can cross-sectional be classified as observational study too?
Yes.
Okay, not just descriptive.
Yeah. Descriptive studies are all descriptive studies in general are observational. So does that make sense to you?
Hello, Prof.
Yes.
Hello, Prof.
Yeah,
I've
it
come
does.
across a term. Hello, Prof.
Yes, go ahead. I can hear you.
Okay, sir. So I've come across a term which I want to confirm if it's authentic. It was called cross-sectional analytic study. Is there such study design, and how can we differentiate it from case control study, if at all? Yes, such a term actually exists.
Such a term does not exist except in the mind of some over-imaginative individuals, or they want to reinvent epidemiology.
Yes, sir.
Cross-sectional is it's a descriptive study. It's so again, descriptive studies just focus on quantifying the burden of a disease or of an outcome and describing it in terms of person, place, and time. Analytic study, so the range of descriptive studies will include things like cross-sectional studies, ecologic studies, and your favorite. I have discovered that your personal favorite, all of you collectively, your favorite study is a case series. You may not know it, but every time you guys describe something, it always defaults to a case series. I'm not sure why you're fascinated with, maybe because we have a lot of doctors here, so they're used to just case notes or case, but case series is an example of a descriptive study. A case series, again, is when you go to a hospital or to whatever setting, and you're capturing records for only individuals who have the outcome of interest, right? So think of, in this case, if you were to go and collect records for all individuals who have Legionella's disease, that's a case series, because you are only looking at individuals with the outcome, right? That is not what a case control is. That is not what a cohort study is, right? So we want to make sure that we know the right study. In this case, you should also be able to articulate clearly why we would need, or circumstances in which we will need only people who have the outcome. Maybe we're interested in a natural history of a disease. So maybe we're interested in, oh, wow, what happens to you when you have Legionellas disease? What are the long-term complications, right? Now, that kind of question is best answered with a case series, right? Where we'll say, okay, we'll take these individuals and maybe we'll create a registry where we'll follow them over time, right? But not when we're trying to look at the relationship between exposure, and outcome, right? If everybody has the outcome, then that means we can't measure the relationship between the exposure and the probability. Remember that one of the assumptions for causal inferences, even though we're not trying to do causal inferences, is positivity. Positivity means that the probability of having the outcome must be a positive number between 0 and 1, but not including 0 or 1, right? If everybody has the outcome, the probability of having the outcome is 1. That has already violated positivity. So we cannot measure anything that way. We need some people to have the outcome, but not all of them. Otherwise, that would be a violation of positivity. So I hope that makes sense.
Yes, Prof. Thank you so much.
Any other questions? All right. So this is our case control study, right? This is the background here. It talks about, lead contaminated water and its health effects, but that's not what we're interested in. And let's just quickly look at the aims to quantify the relationship between drinking of lead contaminated water and development of Legionella disease. The specific objectives are for aim 1 is to determine the strength and direction of a relationship between drinking lead contaminated water and development of the outcome, and compare the levels of exposure to lead contaminated water between cases of Legionella disease and controls without the disease, right? But let's go to the more interesting part that we want, which is the approach. So in a case control study, you first of all, define the population, right? And in some cases, we want to make sure want to note that the definition of the population of a case control is sometimes more of ideological or almost philosophical, right? Because we say controls must be individuals who would have. So there's the clause we use in case control studies, would have. That's a very important clause. Everything we're doing in case control is like, would these individuals have done the same thing, right? So if we're talking about, for example, hospital case control studies, would they have gone to the same hospitals if they had developed the outcome? That's how we know that they came from the same population. But anyway, so in a proposal for a case control study, you want to make sure you define how you're going to select cases, how you're going to select controls, how you're going to collect the data, right? Remember, in the case control study, we start from the cases and then we try to assess the exposure. So how are you going to assess exposure? And how are you going to assess potential confounding, like including matching? How are you going to, do that, right? And then the analysis, of course, very importantly is that, in case control studies, we always use conditional logistic regression because it accounts for the fact that controls are matched to cases. So these are the basic elements in designing if you're writing a proposal for a case control study, you must have these elements in a minimum. So the whole idea behind the AI toolkit is to say, well, you just want to do your case control study and you have no idea how to write it. So this allows you to come here, develop this stuff. Now you have this is more than decent. You have a strong foundation to start from. Now you can now pick this, download this as a Word document and start making your edits. The idea is not that you're just going to take this and go and submit for a grant. That is that you're going to make meaningful changes to it and then proceed with that. So that's how a proposal for a case control study would look like. Now let's look at the same topic, right, and see how it might look like for a cohort study, right? So let's say we want to do a prospective cohort. So topic I believe was relationship between consumption of lead contaminated water and development. I'm just going to copy this and paste it here for save time. Now let's do a retrospective cohort. Let's see how, the minimum elements that we will need to address in in a retrospective cohort. Again, the outcome here, same everything, right? Exact same study. So the idea is that you can, for the same research question, you can answer it so many different ways. Drinking of lead, contaminated water, the main outcome is development of Legionella disease. Again, just to keep it consistent, United States. I'm just going to pick a degree, random degree. And then again, just anything here, 2 years experience. You can put in, as much as you want, but if you don't want to put in a lot, you can just put as little as you want as well. The platform has enough training to know that, okay, I'll take what I have and develop what I need to develop in, let's say, just research. Let's say I don't have a lot of time to be typing a lot of stories. All right, so now we want to, the same study design, I want to do it with a retrospective cohort. Let's see how that works out then. So that we can just highlight the key elements for that. Why it develops, does anyone have any other questions based on what we've discussed? How many of you feel confident?
Sorry, Prof.
Go ahead,
Sorry,
yeah.
Prof. Before you continue with questions, I'm just asking everyone to please like our content on our LinkedIn page. I've just posted the slides and I'm posting the link again. Please, this helps us a lot with our marketing, and I appreciate those who have already done so. Thanks a lot. Prof, you may continue.
All right. Okay. So how many of you feel confident in your ability to design sorry, hold on a minute, please. So how many of you feel confident in your ability to design a retrospective cohort study? Anybody? Nobody? Okay. All right, great. So any other questions?
Hello, Prof.
Yes.
Yeah, so what I wanted to clarify here is that if, for example, my study was a cross-sectional study,
yeah,
is it possible for me to still draw associations between factors and to pass for cross-sectional, or I have to leave it at just a description of my findings? I mean, can I make associations between different pair of factors? Am I still within the realm of cross-sectional study?
Yes, you can. Remember we said that associations are a two-way traffic. A associated with B means B is associated with A, right? And of course, we use cross-sectional studies to look at. Cross-sectional studies are a very important study in epidemiology because they are one of our biggest tools for hypothesis, generation, right? Because we confirm studies in general as hypothesis confirming or generating. So we might look at, wow, the relationship between, let's say, smoking and tooth loss, right? I would say, smoking is associated with tooth loss. Maybe we can examine that in another study type, right? So yeah, you can definitely look at that. But I think that's where people get confused when they say things like cross-sectional analytical. They say, oh, well, I'm using a cross-sectional study to analyze the data and look at associations, so it must be analytical. Well, that's not how it works. All of that analysis is still hypothesis generating, right, within the context of a descriptive study. So yes, you can use, as far as you don't overinterpret the results or step beyond the boundaries of what the evidence can generate.
Thank you so much, Prof.
You're welcome. All right. So one of the things you can do also is, you can definitely try your hands with, we don't have much time, but definitely try your hands with the proposal builder. Try and create a proposal for a cohort study and take your time to read through it carefully. Cohort study, a retrospective cohort, a prospective cohort, maybe even a randomized control trial for the same topic. And then see how focus especially on the approach, right? And see how that differs, right? So that's a great way to also just learn and refreshing what we've just covered in the class, so that hopefully when you go to a court of law to serve as an expert witness, you would be able to hold your own ground. So how many of you are going to be willing to go and testify in the court of law for an epidemiological issue? Any takers? None? Yes, that's the spirit. All right, yes, I see some hands up. All right, that's great.
Yeah, sorry, Prof. I have a question.
Yes, please go ahead.
So I'm currently doing a cross-sectional study, but specializing on data quality. So in my country, we're using a specific tool which we use for the assessment and the storage of immunization data for children. But different facilities have their different inputs. So I'm doing a study to compare the data quality among different facilities. So because the system does not have the human number of human beings or number of personnel available at the particular facility in a particular time, because the study I'm doing is over a period of time from 2021 to 2023. So is it possible to draw any association between the facility and the data metric I'm looking at using the system?
So if I get it right, you are trying to, you have, let me see, you have facilities, right? So you have facilities.
Yes.
You're trying to measure quality, data quality across the facilities.
Yes, exactly. Yes.
Okay. Well, you can definitely do that, and that's the whole reason why sometimes we you can consider the variability in the sites as just noise. That may not be a very interesting research question in of itself. I'm assuming that's not your primary research question, right?
Yeah, so because the system generates data and the system has indicators. So I'm using those particular indicators to measure the data quality among different facilities. For example, the timeliness of vaccine given. Is the child given the vaccine at the right time or at the wrong time? Because the country has a specified time required for a vaccine, for let's say example BCG and the Penta 1s and the Penta 3s. So looking at timeliness, how many facilities have reached timeliness? So the completeness of the data, any child that is recorded for all the variables that the system requires, is that all available in the system for a particular child? It measures that for the individual facilities. But the reason why I'm asking this question is for all the data quality papers I've seen, most of them measure the relationship between the personnel available on the ground, their level of training, and the data quality of that particular institution, and they compare it across the various facilities. So, but in this particular study, I'm not looking at the number of personnel and the level of training, because I'm looking at it from 2021 to 2023. And during this particular time, different facilities have different numbers, and the numbers are not static. They keep on going and coming. So I don't know how to go about that particular thing.
So the only problem is that, yes, of course you can compare, but any interpretation from that kind of analysis will have to be qualitative. So, and this is best done in the context of just evaluation or like process evaluation specifically. Because the problem is you run into issues of multiple comparisons. You have many centers, right? And so you start comparing this center versus that center versus that center. That is a whole lot of comparisons, right? The number of possible comparisons in this case would be n combination 2, where n is the number of facilities and, you know, obviously pairwise combination. So if you have 10 facilities, that's an astronomical number of pairwise comparisons, each of which raises the family error rate for a type 1 error, right? So that's just a challenge. So that's why in general, right, you for this kind of analysis, you want to make sure that you're just keeping it just broadly. You know, what's a broad take-home message? That's what we mean by qualitative interpretation of the data, right? It's not as if you're now going into the nuance and saying this, you know, this and this versus this and that. But in general, I think a better way to even analyze the data will be capturing the facilities as a random effect, right? So if your outcome, because let's say given a research question, you're trying to look at vaccination coverage in children. That is your main effect. That's what you want to detect. But the children, the data come from different facilities, as you have mentioned, right? And you, of course, understand that there is a lot of noise that is coming into the data by virtue of the kind of facility it's coming from. So in that case, your analysis would capture the main outcome as a fixed effect, but you will also account for the facility as a random effect, right? That way you capture the noise in the data, you capture the variance appropriately, so that the estimate of a fixed effect is valid. Now, that would be a more appropriate way to handle that, as opposed to just saying, well, let's just do a whole series of comparisons, because the type 1 error from that is just going to be, you know, very enormous.
Okay, thank you. Thank you very much.
You're welcome, yeah. Okay, we are both beyond the time. I see some hands up. Any other questions?
Yes, I have a question, Prof.
Please go
Hello,
ahead.
Prof. Okay.
Okay, thank you so much, Prof, for all you do for us. My question is tilting towards the analytical aspects. For my dissertation, I'm using a secondary data set, the ENS data, for my dissertation. And on my analytical plan, I wrote that I'll be using different kinds of regression methods, including structural equation modeling. However, I got a feedback from my committee member saying I supposed to run a sensitivity analysis since I'm using a secondary data set. So I'm a little bit confused because I don't want to repeat all that I've written on the analytical plan in the sensitivity analysis. So what other analysis do you think I can write under the sensitivity analysis that will be different from the major analytical plan?
So let's start from, what do you understand by sensitivity analysis?
Okay, I know that sensitivity analysis will be done when you are using a complex data set like ENS data, where you do a kind of multi-stage sampling.
Okay, all right. So so that is not exactly what sensitivity analysis is per se. So first of all, sensitivity analysis could be anything, right? The reason why we do sensitivity analysis is to see whether our results are robust. Now, in research, robustness of findings means that when you change an assumption, underlying assumption, the results don't change widely. If we did a small tweak to our case definition or whatever assumption, right, and the results drastically change, it means that our results are not robust. It means that the smallest thing changes them dramatically. We don't want that. We want our results to be stable, right? Like as stable as a house. Even when the winds come, it's still stable, right? You know, a house that just topples over will not be a safe house. So that's how we want our estimates to be. So sensitivity analysis is essentially saying that, well, these assumptions I have made about this particular, let's say, model, how stable are they? If I change the assumption, how will the results stay the same? That is what sensitivity analysis is supposed to do.
Okay.
So it seems here that, you know, there's not much clarity on your end, because for you to do sensitivity analysis, you need to have in mind what you expect to do. So it's not somebody else that will tell you the sensitivity analysis to do. You have done the analysis and you say, well, this assumption that I made. So but we didn't make the assumption with you, right? Like, we don't know what the assumptions were. that you made. So you are just, it's all about testing the assumptions you have made and seeing how robust are these assumptions under changing definitions. Does that make sense?
Okay, maybe I'll need to read more about it.
Yeah, you can read more about it. So it can be, but that has nothing to do with secondary data. So I think that's the major issue here, right? It's sensitivity analysis is not a, it's not necessarily about a data source per se. It's about particular analysis. So, in your case, for example, you say you're doing a structural equation modeling, right?
Yes.
And you're saying, well, we're trying to measure some certain latent constructs. Expect that, the theories that so and so and so are latent measures of this particular construct, right? And so let's say we use we decide that let's say we measure a variable. Let's say a particular variable we use was captured as a continuous variable. What happens when we diagonalize it, right? Those are the kind of ways you want to think about sensitivity analysis. So it's not necessarily about whether data is secondary data or not.
Okay.
The assumptions you made. If we challenge those assumptions, how well do the results stand the test of the sensitivity analysis?
Okay.
That makes sense?
Okay. Yeah. Thank you very much, sir.
Okay. So in your case, if your supervisor really wants you to do something else, one of the things you can do is to create weights. You can say, well, we are, I mean, you really have to understand, first of all, what you're trying to achieve, because sensitivity analysis is not something somebody else tells you. It's something you say, these are the assumptions that I made. Now let's test them under different conditions and see whether they are different or not.
Okay. Like testing it with different methods, right?
Yeah, changing the case definition, changing some other assumption, changing the type of regression model, for example.
Okay.
Whatever, right? Then seeing how well the results hold.
Okay. Thank you very much, sir.
You're welcome.
Yeah.
Okay.
Hello, Prof.
Yes.
Okay. Sorry, sir. I'm raising my hand. The previous speaker, or the penultimate speaker.
Okay.
I was just thinking that instead of taking the facilities, individually, they can be grouped. Maybe all primary facilities taken as one population in quote versus secondary, so that instead of having so many facilities and analyzing them, we can now analyze them as groups or as a group, like maybe primary versus secondary, or I don't know how they group their facilities maybe in the country. I was just thinking that may be a way, instead of having so many facilities and then having to, get too complex in the analysis, just like as you explained. That's just the opinion I want to share.
All right, thank you.
I don't know how to. Okay.
All right. Any other final thoughts? Okay, I guess they're none. Sorry, Afion Ibanga, you have your hand up.
Yeah, I want to just good evening, Prof.
Hello.
I want to get some information or some advice. Okay, so there is a disease, and you're thinking that something in the diet may be causing the problem. I'm just wondering how best to go about that. You don't know what is in the diet.
Okay.
But you think diet might be a problem. How best can someone go about unraveling that?
Is it an individual? Is it in a population? Like, what's the context?
The context is a group of people with a disease. And you think the diet may be the culprit, but you don't know what in the diet it could be.
Well, you can start by
just knowing that diet has so many components. So
okay. How
would you go about that?
Well, you can start by, there are many ways to start. There's not one way, right? One, you can start with the food diary, right? You have individuals maintain extensive food diaries for every single thing. The problem is that it's extremely hard for you to for people to keep records, food diaries, right? Because it's just hard to keep it. But you could start by giving all of them food diaries, every single thing they eat. They will capture it in there, right? You can also, if you live around them, in some studies, we actually go to people's house and remove the trash from, and see what's in there, right? That way you can look at individuals, by the kinds of you can explore the role of a different, ingredients or the different food constituents, right? You can also do a, laboratory analysis, right? That's something that, if you've narrowed it down to a few things, sometimes that's somewhere where we start, but there's not a whole lot of context in there. So, but that's some of the things you can think of in your situation. A food diary will be the most efficient way, but you have to make sure that you do response rates to be very high for you to be making meaningful insights from that data. Oh,
yes,
I see.
thank you.
So if the
Thank
disease
you.
is already there, okay, I see the comments there. So if the disease is already there, that falls into a condition of a case control study, like we discussed last time. You have an outcome that is well established, and then you're suspecting something. You don't know what the exact food, but you cannot come into a study and say, I don't know anything. You must have some suspects, right? So you list out all your suspects, right? And then you include them in the assessment, in the questionnaire. Have you eaten this? Have you eaten that? Then you compare, the specific exposures between cases and controls, right? That's why we have case control studies. But you need to have at least some suspicion of things to include. So it can't be that I have no clue whatsoever. You need to have a clue, first of all. And that's where the food diary comes in, right? People complete food diary extensively. That gives you can now go through those food diaries and say, okay, I think these are the suspects I'm going to include in the study, right? So that could be one way to approach that.
Okay, thank you.
You're welcome. Okay, thanks everyone. I believe there are no other questions. All right. Sounds good. All right, thanks everyone. Have a beautiful weekend.
Same to you, Prof. Thank you so much.
Thank you.
Thank you so much.
Thank you.
All right, thanks.
Make sure
Yeah.
you fill the
Thank you very much,
evaluation
Prof.
form.